Because there is controversy as to the guidelines as to how early these exams need to happen, or these screenings need to happen.
Absolutely. So yeah, so 2009, the US Preventive Services Task Force came up with a conclusion based on analysis of data that it wasn't necessarily worth it to do it below the age of 50. And you know, the American Cancer Society, for example, recommends 40 to 44 to be a, you know, pretty much an independent decision.
Right.
And then, but we believe that at 40 everyone should, at a normal risk, right? At a high risk, you should start early.
Now, what are some of the symptoms that women experience when they have breast cancer?
So often than not, because the technique of screening has become widely available, is usually that the patients do not feel anything. And so that's
really?
the reason, yeah, the main diagnosis comes after an abnormal mammogram. And that's the reason for the shocker, right? So you go for your screening mammography, and then you're found to have an abnormality that requires a biopsy, and that's how we ended up diagnosing breast cancer. But
at this point, a patient comes in because they're feeling something, so they want to go in and get an MRI, and they want to go in.
Exactly. So then there's the group of patients that actually feel something, and arguably the ones that are usually below the age of 40, where there's no screening mammography going on. The most common finding is a lump.
Right.
It's a painless lump. That doesn't mean that it's a sole abnormality that should make you seek attention, right? So any changes in your breast, and that's the reason why self-recognition of your own body, I think, is important, is vital. Like, changes in the color of the skin of your breast, nipple changes, nipple inversions, scaliness of the nipple. These things are not necessarily normal.
Right.
That doesn't mean that it's going to be breast cancer, but at least you have to start by talking to your doctor about it.
Now, what about fibrocystic lumps? Are those often confused for a lump that could be cancerous?
Yeah, so fibrocystic lumps, or also fibroadenomas or benign cysts, are not necessarily confused by providers with cancer, in the sense that if you go through the diagnostic workup, we can tell you and rest assure you that these are benign conditions, but getting to be 100% sure that those are benign just based on a physical exam sometimes is tricky. So although we have some guidelines, like the harder the lump, the less mobile it is, the more suspicious it's going to be. That doesn't mean that a softer, rounded structure could necessarily be a normal benign tumor. So have it always checked.